All right, we're back with you answering all your coronavirus and COVID-related questions and vaccine questions with Dr. Deanne Brooks from Cone Health. All right, so this person says, I got my first Moderna vaccine in July. I have not received my second. Am I okay to still get my second shot, or do I need to start all over?
Yes, you are okay to get your second shot right now. You do not need to start over. Go ahead and get your second shot now, and then in 6 months, get your booster.
All right, this person says, if you mix a J&J with a Pfizer, isn't that just like getting one dose of J&J and one dose of Pfizer? That's not fully vaccinated with either one, not even a booster. How does that work?
Yeah, so it works based on your body's immune response. And so once you get the Johnson & Johnson vaccine, that's a one-dose vaccine that boosts your immune system to be fully vaccinated. And so then when you get the Pfizer on top of that, it is a booster to that Johnson & Johnson vaccine.
Okay. Would it be different if you had gotten just one Pfizer and then you tried to get the Johnson & Johnson booster or something like that because you actually needed 2 doses of the Pfizer?
Right. For that one, we would suggest completing, just as the other caller or person had asked, go ahead and complete your first series, and then you could get a booster. And if you wanted to have a Johnson & Johnson for the booster 6 months later, you could.
Okay, gotcha. All right, so this person was asking why there could be a major global spike in the vaccination rate.
So it's very possible in terms of globally. We know that the United States as well as other countries are working to get vaccines to other countries that have low vaccination rates. So that could be a part of it, as well as people are concerned about the increase of a new variant that has come on board, and that's what viruses do. They change all the time, and we also have a holiday season coming up, so it's very possible that a lot of people were also getting their boosters or now getting fully vaccinated.
All right, well, this is kind of a follow-up. So they're asking, how do they test for the new variant? Is it the same as the normal test?
Yeah, so it's interesting. Whenever we get tested to see if we are infected with COVID-19, we don't have a way of knowing which variant we personally, individually have. But the state does have the pooled information, and they're able to pull out what the predominant variants are within our community, as well as being able to tell that a new variant has come into our community.
But the actual test, like the nose swab or whatever, that is the same as it was for the Delta variant or regular COVID?
Yes, that's the same.
Okay. This person says, I lost my Pfizer vaccine shot information card. It's time for my booster. What am I supposed to do? I'm panicking.
So first of all, don't panic. You can come and get your booster if you do not have your vaccine card. We do ask that you attest when you received your second dose. And so we'll ask you for that. And then the state also has, you can just Google, I lost my vaccine card in North Carolina, and there is a portal that you can go to. If you have difficulty with it, there is a phone number that you can call, and an agent from the state will help you get that information.
All right, and we'll put that in our web story that we're going to put all of this information in as well. That way you'll be able to click on that, and it's really simple to look up your vaccination information and just print it off for yourself. All right, so this person is saying, I was sick for 24 hours after my second shot. I've heard the booster can be even worse than the second shot. Is that true?
So it's very individual. It's the individual person. I have heard some reports of recipients who received the booster vaccine that have been more sick than the first two, and I have heard others that had no problem with the booster at all, even if they did have reactions to number 1 or number 2.
So this person says, my wife and I are 75 and 69 and fully vaccinated and boosted, but son, wife, and 3 kids, 8 and 12 years old. Should we allow them to come in our home or just let them visit to open gifts if they get tested and show proof of a negative test? They're worried that close contact with those family
Right,
members.
yeah. And so, the recommendations are stay outside as much as possible if you can. We know that this is a period of time that we can get cold and rainy and possibly even snow, so that might not be possible. I would recommend that if you wanted to get together, for everybody to be masked and social distance as much as you possibly can, and then really limit that time together.
All right, so maybe the staying in the home is not the best part, but the opening gifts can be something that can be managed. That is something
Right.
that, yeah, they'll have to think of themselves. Okay, this person says, I took my last shingles shot on the 17th of November. When am I able to get my Pfizer booster?
They can go ahead and get it now.
Okay, so there's no issues with that.
Yeah, they're at the beginning, we've learned so much more about both the COVID-19 virus as well as about the vaccines. There was a time that we recommended not giving vaccines, any other vaccine with the COVID-19 vaccine, and that recommendation is no longer in place.
Okay. This person says, why do you have to wait 6 weeks to get a mammogram if you've had a Pfizer booster?
So the reason for that is that sometimes your body can create an immune response that it may possibly cause a lymph node to swell. And so it might cause a potential concern in that mammogram that you might have to have some additional follow-up. And the recommendations for that change as well. And so what I would do with that also, if you're scheduled for your mammogram, just call wherever you're getting that and ask what the current recommendations are and tell them when you received your last vaccine.
Yeah.